Hi, I'm Judy Richards, and I'd like to introduce Selma Pierce, Republican candidate for House District 20. Welcome.
For helping me.
Selma, tell us about your positions and your experience that would encourage a senior or a person with disabilities to vote for you.
Well, I am very supportive of services that are offered to seniors and people with disabilities to live a full and independent life. Almost every family has older or disabled family members. It is very important to everyone to care for them with dignity and love. Assistance in doing so is so very important, both for the families and the persons they are caring for, because it is hard work. I have helped to care for my mom and my 92-year-old mother in law for the past 12 years. My mother in law became disabled, she recovered, and now is able to age gracefully in her own home. Having gone through all of her ups and downs with her and helping her maintain her independence has really been eye opening and gives me an idea of what all other families are going through. I am fully aware of the need for services and help that organizations such as Northwest Senior and Disability Services offer. The assistance they give to families is invaluable, particularly with help with meals, health and wellness, counseling, finances, and particularly family respite care.
Oregon Project Independence is a cost effective program that keeps seniors and people with disabilities in their own home. And at every year, proposed funding for OPI is significantly cut. If elected, what would you do to protect this funding for OPI?
I would be voting for funding for this program, Oregon Project Independence. I know how important it is for seniors and people with disabilities to stay in their own homes where they can live comfortably with a little bit of help. Almost everyone I know, including my relatives, would prefer to stay in their own homes. This is their primary preference. Their greatest fear is that they will have to leave their homes. Project Independence is cost effective, much less expensive than moving a person onto Medicaid and then into a facility. It allows many people to maintain their personal dignity and sense of self. They don't want to go to a facility, which is much more impersonal and is often disorienting to our family members. Often they are very lonely, isolated, and sad when they have to move out of their homes. So it is of great importance that there are programs that help people stay in their homes, because that is where our family members are the happiest.
How would you prioritize state funding, including the funding that is matched with federal funds, such as Medicaid, for services to an increasing senior and people with disabilities population?
State funding for programs that aid our seniors and people with disabilities is very, very important. This helps lightens the load on families who are caring for their family members. Oregon should also pursue any federal funding available for seniors or people with disabilities. State and federal funding together give Oregon more resources to aid our older citizens and people with disabilities. This is important as our society ages and there are more people needing care. Funding should be spent on meals and nutrition, health and wellness, mental health help, transportation, home assistance, emergency housing help, and connections to services that help people live a fuller life. So I am very much in favor of prioritizing state funding for these programs.
During the time of increased risk of homelessness and food insecurities, what will you do on a state level so that seniors and people with disabilities are no longer faced with a lack of accessible, affordable housing and receive appropriate nutrition?
I am I am very much in favor of maintaining funding for these programs because they do help our citizens quite a bit. So food and housing are some of our most basic needs. And with help from both federal and state funding, many seniors with disabilities can stay in their homes. They're helped with delivered nutritional programs such as Meals on Wheels, which my mother-in-law does partake in, or in group gatherings for meals like those at Center 50 Plus. With collaboration between nonprofits and community organizations such as Marion Pope Food Share or United Way, donations from supermarkets and other food providers, food insecurities are being addressed, especially at this time of the COVID pandemic. Many food providers are helping with providing clients with food boxes so no one goes hungry. And many community members have also stepped up to help, as we have seen during the wildfires, and people in the community saying, I want to help, and they bring a lot of goods and materials to the centers where people can have resources that are later distributed to among those that are displaced. And housing is also an issue that our state wrestles with. We're already short of housing for our communities. So decreasing rules and regulations and simplifying build design requirements allow for more basic, simple yet serviceable units that would help lower the cost of building affordable housing. This allows our seniors and people with disabilities on fixed incomes to have more access to homes to live in.
What are your plans to improve the health of vulnerable seniors and people with disabilities, including people of color who traditionally suffer from more health disparities due to pre-existing conditions?
Many people in our society have chronic health problems such as heart disease, lung disease, strokes, Alzheimer's, diabetes, and obesity. These conditions are prevalent among seniors and people with disabilities. We need an emphasis on healthy habits and lifestyles among all populations to reduce the prevalence and severity of chronic health conditions. And these kind of programs that would help people understand how to make themselves healthier, how to live a healthier lifestyle, should be culturally sensitive, that work for different groups. I know my own grandmother was told she had diabetes, and she was told to delete rice. And in her case, she felt like it was removing her lifeline, and she was not used to that. So that didn't work for her. So we can develop programs that work for different communities and backgrounds. But we should also have an emphasis on don't eat too much, don't smoke, don't take drugs, get some exercise, and have a purpose in life. Even small changes can make a big difference in healthy outcomes for everyone. And I am happy that Northwest Senior Disability Services offer nutrition and meals and health programs that help to educate and help seniors and people with disabilities live healthier lives. Their healthy and nutritious meal programs are really a daily lifeline for many people. So this type of education really adds up to improvements for everybody. So I am pleased that right now we do have programs that help people tailor their lives so that they can live healthier and better lives that go into the future. But these should be also emphasized for our younger people, so they will have much more of a healthy older age. So that would be very nice too.
Thank you. We have been visiting today with Selma Pierce, Republican candidate for House District 20.
Well, I want to say thank you very much for giving me this opportunity, because as we live in a community with many people, many families have seniors or people with disabilities in their families that they're caring for. And it's nice for them to know that these resources exist to help everyone so everyone can have a happy life.
Thank you. And thank you once again, Selma Pierce, Republican candidate for House District 20.